welcome to True Health Tuesdays. Thyroid removals. Okay, next week we're going to find out why it's a massive increasing incidence in thyroid removal. We're going to find out how to take care of the thyroid because it's not a spare part. This is for the poor people that have absolutely had their thyroid removed. And you're going to see next week the ridiculous over-diagnostic procedures and how it's being ripped out because for profit. So what the thyroid is, it's a little butterfly-shaped gland right below the larynx, a couple inches long, but it's super highly vascularized because the thyroid, the hormones it produces are involved in almost every function, every organ system of the body. This is what it looks like. It's actually really kind of cool. You can see some of it on x-rays occasionally. Now, it's responsible for the hormones. They literally affect every aspect. It produces T3, T4, and T2. Now, there's other organs in the body that also produce thyroid hormones, and this is kind of cool. The ovaries can produce T2. Immune systems can, like the white cells, can also produce thyroid hormones. So even though it's a thyroid hormone, it doesn't necessarily need to be from here, but this is the main production. Now, they regulate metabolism, body weight, required for growth and development. You'll see next week a lot of thyroid disasters for iodine deficiencies. We're talking mental development, so pregnant women aren't getting sufficient amounts of thyroid or of iodine. The mental development in kids is horrible. Certain disease rates, all growth factors. So you're talking bone tissue, blood production, nerve production, skin production. Now in women, pregnant women, it helps the milk come down, but it also interacts with other hormones, the thyroid hormones do. So we're looking at insulin, cortisol, sex hormones. I mean, this isn't a vestigial gland, this is vital. Now, thyroidectomy is removal of part or all of the thyroid gland. The tough part with this is it's recommended, okay, and this is to the Mayo Clinic, for the thyroid cancers, but it's also recommended for goiter, a hyper or an overactive thyroid. It's now super overdiagnosed for different nodules. So we really have to find out why they're doing it, but again, this talk is just for the people that have had it ripped out. How much of the thyroid gland is removed? It depends on the reason for the surgery. So if only half of it's involved, hopefully the surgeon will be conservative and not rip out the whole thing. If the whole thyroid's been removed, it's called a total thyroidectomy. And if the thyroid has been removed, you will need to be on hormone replacements for life. Okay, now the complications, these are just some of it. I mean, we're looking at bleeding, infection, injury to the laryngeal nerve, the recurrent and superior. Thyroid toxic storm, this is a really rare condition that doesn't happen that often lately. Hypoparathyroidism, and you've got the thyroid, you also have parathyroid glands that regulate calcium, and you're going to find out that that's deadly. And hypoparathyroidism, because those glands are also injured in a thyroidectomy, usually. Chronic hypoparathyroidism, this means hypo means low, parathyroid gland. It's serious and potentially debilitating disorder that results in a variety of causes. The most common is thyroid surgery. So you've got the thyroid gland, you've got glands on either side called a parathyroid. If those things are damaged, injured, or accidentally removed, whoops, shit, just took out the parathyroid. I mean, can you imagine that? You know, yeah, it's only responsible for regulation of blood calcium levels, and we're talking psychosis can happen and disease rates. You know, I sneezed and I just cut it out. Persistent post-operative hypoparathyroid usually results from intentional or inadvertent removal of the parathyroid glands during the thyroidectomy, or from interruption of the blood supply to the glands with subsequent infarction. That's the Journal of General Internal Medicine. I mean, this is not something to be taken lightly. If somebody has an overactive thyroid or nodules, for God's sake, I mean, take a second look before they rip it out. Signs and symptoms of low blood calcium levels, hypocalcemia. We're talking paresthesias in the extremities, muscle cramping, positive Chvostek sign, and it's like if you tap the masseter and you get like a twitching, but that's some severe low function. No, you don't have it. No. I know. And by the way, you can't lick your elbow either. How many people want to try it? Okay, convulsions. Okay, and some of these can actually be fatal. So this is not, and we're talking long-term hypoparathyroidism, cataract development, basal ganglia problems, recurrent seizures, osteomalacia, psychiatric symptomatology. So this is hugely important. Now, once the thyroid's been removed, okay, and hopefully they didn't injure the glands on either side, the parathyroid, your body's not going to produce the right hormones. If only part of the thyroid's been removed, you may be able to produce enough hormones. So that's ideal. So if you're going to have it out, hopefully they're very conservative. But when the thyroid's been removed, you will have to be on the hormones. So now, I love this. This is the Journal of Internal Medicine. Now, this was 100 years ago. Okay, the surgeon wrote this. The serious complications from thyroid surgery. Now remember, 100 years ago, we had the same type of humans. Psychiatric problems, blood issues, bone issues, skin issues, all from removing this gland. I love this. If a surgeon should be so foolhardy as to undertake a thyroidectomy, lucky he will be if his victim lives long enough to enable him to finish his horrid butchery. I know, I like that. Some people just have ways with words. Okay, now, and when you look at this, even the surgeons are saying, for God's sake, look at it a second or third or fourth or fifth time. With the advent of improved surgical techniques, effective preoperative medical therapy for hyperthyroidism concern for the development of a potentially fatal thyrotoxicosis or storm has abated. Nevertheless, the intern should continue to refer patients for thyroidectomy with some unease and caution because of the risk of permanent hypoparathyroidism and paralysis of the recurrent and superior laryngeal nerves. So yeah, people are surviving with this, but please, for God's sake, use caution. Okay, so if you've been diagnosed with nodules, if you've been diagnosed with, I mean, we're going to cover it, how to eliminate nodules and how most nodules aren't even a problem. But that's the Journal of General Internal Medicine. It's serious. Now, the Canadian Journal of Surgery. No, I didn't put this in there because we have a number of Canadians here. They're all sitting in the second row. It's weird. And some in the back row, yes. There's a reason Canadians amassed most of their population within 100 miles of our border. Historically, the risks associated with major surgery to treat thyroid disease and the problems of adequate hormonal replacement deterred surgeons from performing total thyroidectomies. Although the procedure remains controversial, it is increasingly being performed. You know, when you look at it, they're saying that you know, it's hard to replace the whole hormones because any organ that produces hormones, it's not going to produce it on one level. But if you take a pill, that pill is going to be dissolved, put in the system, and it's not going to be utilized as needed. Okay, so even the best hormone supplements, there's going to be a change in utilization of it. So it won't be like a normal functioning thyroid. So now we have radioactive therapy, and this is a way to destroy that. So we know the thyroid takes up iodine. Oh, what were those other two organs that took up iodine? Oh, the blood, you know, the bone marrow and the ovaries. Okay, let's not think about that. Okay, what we're going to do, we're going to take iodine and add a radioactive isotope to it. Survey says, problem? Well, there's a couple of problems, okay? Treatment is used to destroy any thyroid tissue not removed by the surgery, or to treat some types of thyroid cancer that has spread to the lymph nodes and other parts of the body. Next week, we're going to talk a little bit about lymph nodes and how they are little tiny anti-cancer factories. They're really good. Now, your thyroid gland is supposed to absorb all this radioactive iodine, and it's also known as isotope 131. It's taken into the body in liquid or capsule form and concentrates in the thyroid. And the radiation can destroy the thyroid gland. It's basically taken up there. Now, this is from the American Cancer Society. You got to be careful if you do this because you're going to be radioactive. So they're going to isolate you. Yes, you're going to have to stay in like a hospital room for a little bit. You don't want to be around sensitive people, like people with organs, eyes, skin, pregnant people, young people, old people. The people in the middle we don't really care about. They'll probably survive. Honest to goodness. Have you seen the commercials for some of this stuff? It's like, yes, it's dangerous for young people and old people. You know, what about I'm in the middle? You might be in the hospital a few days, be isolated. Once you go home after treatment, you'll be given instructions how to protect others from the radiation exposure that you're leaching out over everything. Men who receive large doses may have lower sperm counts or become infertile. Women may have irregular periods for up to a year. Oh, wait, that's right. Oh, you know, I just thought about it. So we're having radioactive iodine, and the ovaries produce a thyroid hormone, and this is going to be taken up into the ovaries and other tissue. Oh. They should avoid becoming pregnant for about 6 months, and you have a risk of developing leukemia. So if you do have thyroid cancer, I mean, what do you see? To take care of the thyroid is so much simpler than this. Okay, this is not a simple procedure. After a thyroidectomy, body can no longer make thyroid hormones, and this is a total thyroidectomy. So you got to have pills to replace it. Now, here we go, thyroid hormone replacement. And it's interesting because you would think, and this is how a lot of doctors think, that since you've had this organ removed, it produces T3 and T4 and T2, we just give you that, right? Should be straightforward, simple. Now, according to this medical journal, it should be a relatively straightforward clinical problem to solve. The thyroid is absent, hormone levels are low, the physician prescribes a dose of levothyroxine to replace what the body would otherwise manufacture that resolves the problem, right? Okay. Nevertheless, simple clinical intervention is one of the most common dissatisfactions for the patients that have ripped out their thyroid. The perception that the dose of thyroid hormone is incorrect. Complaints, okay? Lethargy, weight gain, fatigue, brain fog. Some patients feel less well following the thyroidectomy, no kidding, or after the radioablation than they did before their diagnosis. No kidding. I mean, it's really hard. Now, one of the challenges is everyone's trying to prescribe it because you've got the surgeon prescribing it, you've got the internal medicine, you've got the family doctor. So it's not a real simple procedure. It's not like a cut and dried prescription. Now, American Cancer Society, and this is again on hormone replacement therapy. High levels of thyroid hormone can lead to rapid irregular heartbeat over the long run. High doses of thyroid hormone can lead to weak bones. So the regulation, low levels, brain fog, osteoporosis, high levels, you're talking weak bones, thyroid, or irregular heartbeat. I mean, big time stuff. So if you've had your thyroid removed, you will need to take this. So you got two choices. You got synthetic and natural. I know it's going to be a real tough choice on this one. Synthetic is only T4, okay, generally, thyroxine, and that's T4. And the thyroid itself produces T3, T4, T2. There's even a little low levels of T1 produced. The most common form, and this is from all around the world, you're talking Synthroid in America, Levoxothyroid in America, Thyrox in Asia, a number of different names in Europe. So, but it's all the same thing, it's T4. Now, nature thyroid, and this is where they take a pig thyroid, they grind it up, dry it, put it in pill form. Now, this is interesting because it has everything, and this is under Armour Thyroid, West Thyroid, Nature Thyroid. It has thyroxine, T4, it has T3, it has T2, it has T1, and it has calcitonin. And calcitonin is super, super important. This is like vital. Now, according to Thyroid Science, naturally desiccated thyroid containing T3 and T4, most synthetic medications only contain T4 or T3. Many patients don't start to feel normal again until they switch to the one that has more of what they need. I mean, this should be like, duh. Now, this has been used since the late 1800s. So it's one of the most safest drugs, contains a full spectrum. I mean, this is like a no-brainer. The problem with the synthetic version is that a lot of people are losing their ability to convert T4 to T3. And it has to be converted to T3 to work. So, and this is converted in the liver, it's converted in different areas of the body. And the conversion is done by an enzyme. Now, sometimes the enzyme is deficient or not working. And this is multiple journal articles. It's almost like, well, if the synthetic version doesn't work that well, and it doesn't have everything, and the natural one works really well, and it's been around for, 100 or so years, why is there even a choice? Well, let's look at the Synthroid again. Increased fracture risk. Why? Because it doesn't have calcitonin, doesn't really work. And our findings provide evidence that once you've had your thyroid removed, once you've been put on synthetic hormone treatment, that the risk of thinning of the bones increases. Now, the thyroid makes calcitonin, and the synthetic thyroid does not have calcitonin. Oh, but wait, the natural one does. You know what I mean? Okay.
Why is the synthetic even on the market?
Don't ask questions like that. Sorry about that. He has way too much common sense. He should not be sitting. Well, God, all you guys do. Okay. Natural desiccated thyroid hormone, which is just ground up pig thyroid, contains calcitonin, which helps with bone density and prevents osteoporosis. So this is a business. Now, either people are getting massive toxic exposures, but from and this is like 10 years ago, 1996 to 2006, almost a 40% increase. But also the cost of the surgery has increased, even when you adjust it for inflation. You're talking, it went from $464 million to $1.37 billion. And that was 10 years ago. So this is a huge, and when we go over next week, you're going to find out the overdiagnosis, how nodules are scaring the people into, oh my God, it could grow into something else. Okay, so Synthroid, yes, this might answer your question. Okay, and this is in 2000. It's really hard to find data on drugs, individual drugs, and what their product is, but I figured this was 16 years ago, 400 million. Okay, 13 million people in the United States back then, okay, in New York, and this is just Synthroid. It's not the other names of all the ones in Europe and Asia and everything else. Now, so what do you do if you've had your thyroid removed? Well, obviously you got to get on the natural desiccated thyroid. Okay, you can't utilize the Synthroid because that's just doesn't make sense. But also, when you've gone through that surgery, you got to slowly work your body up. So you got to do a clear liquid diet, broth, bone broth would be great, apple juice, plain gelatin. You work up a little bit, because remember, they're actually removing a highly vascularized organ right in the front, right below your voice box. Easily swallowed foods, smoothies, ice cream, yogurt, oatmeal, mashed potatoes. And then, step 3, healthy diet and lifestyle, which would have been really nice because that may have prevented the problem in the first place. I know. Okay. Now, this is going to sound weird because this is just a normal, healthy, plant-based diet. You know, fruits and vegetables, lean protein. I mean, if you really want to protein up, I think cauliflower is like 28% protein. Cauliflower, baby. Okay, healthy fats, you know, low sugars. Now, when it says mainly raw and organic, that's not the goitrogen. It's not cruciferous vegetables. Raw is really good, but you're going to find out that we do need to cook some of the fruits and some of the veggies. Of course, packaged and processed foods, non-organic foods, GMO foods, and goitrogenic. Now, when we look at this, cruciferous vegetables are some of the greatest foods in the world, and we're talking like cabbage, broccoli, cauliflower. They have huge anti-cancer properties. However, they can also, if you're missing a thyroid, or even if you have low iodine content or prone to goiters because you've had low iodine your whole life, it's dangerous. But if you cook these vegetables, they're instantly okay. So, deactivated by heating it. So lightly steam, saute it. It's going to be fantastically good for you. And also soy. Soy is not good for the thyroid, but if it's fermented, like miso or tempeh, and there's huge benefits to miso. Amazing. Now, strength training, because remember, you're taking something out that regulates your metabolism. So muscle mass actually increases your metabolism. So the more working out you have to do, the more exercise you have to do, greater rate of muscle to fat, the higher it increases your metabolism. So this is vital. And the nutrients you're going to need if your thyroid's been taken out. Okay, you do need to take the naturally desiccated thyroid, but also B12, vitamin D, calcium, vitamin C, and vitamin A. And when you look at this, B12 is found in almost every cell of the body. It's required for cellular metabolism and energy production. Now, people without a thyroid gland will have low levels of B12. What do you think if somebody has a low functioning thyroid gland? Low levels of B12. So if you want to have a healthy thyroid, would this be good advice for everyone? Yeah. Underactive thyroid potentially impairs the body's ability to absorb B12. So taking more than the average would be a good idea. And these are the sources. There's some vegan sources, but these are listed as the top 10. I mean, brewer's yeast is up there, but when we look at this, liver, sardines, grass-fed beef, tuna, raw cheese, cottage cheese, lamb, eggs, salmon, fantastic. Now, vitamin D deficiency is associated with all thyroid disorders. So when you're at the pool and you see the mom spraying her kids down with this toxic waterproof sunblock, go up and gently kick it out of her hands. You're saving a child. It's totally understood. You know, when she realizes that anything you put on the kid's skin will, you should be able to eat because it's getting in the kid's blood. And you need vitamin D to regulate insulin. I can't tell you how many patients I get in. My doctor says I'm pre-diabetic. I said, wow, mine says I'm pre-dead. It's called alive. It's like, dude, you're not diabetic. You just are not metabolizing appropriate nutrients or you're poisoning yourself. So let's fix it. Vitamin D helps regulate insulin secretion. So at this time of year, which is the winter time, and it's brutal outside, it got down to like 74. Now, you Canadians wouldn't understand this. Okay, this is really frigid for Southern California. Okay, we're going to have to supplement. Suck it up, Buttercup. I know. Supplementing with calcium and vitamin D prevents the hypocalcemia. So when you have that, they ripped out the parathyroid gland a little bit, so you're having that. You're going to have to supplement with more calcium, more vitamin D. sunlight exposure, but at this time of the year, even in Southern California, we're not getting enough sun, so we've got to supplement. Typically it's 3,000 international units for every 100 pounds of body weight, but you just got to do it. And you need vitamin K2 to utilize vitamin D3. So the fermented veggies, absolutely. Okay, you've got to get it. Certain cheeses are going to have it. And then, is getting healthy amounts of calcium appropriate? For everyone. It is, but if you've had your thyroid removed, it's vital. You need it. So raw milk, kale, and when you look at all the vitamins in kale, it's incredible. And cooking it, again, it'll decrease any negative effect. Sardines with the bone, yogurt, broccoli, watercress, cheese, bok choy, almonds, oh my gosh. Now, I love this. Vitamin C deficiency is linked to all thyroid disorders and adrenal fatigue. When we talk about this, because we've got about 8 videos on thyroid, okay, and we talk about how there's an intimate relationship between the adrenal glands and thyroid. And if one's up, the other's down. So if you've had your thyroid gone, guess what's going to be overwork in the adrenals? So these people are going to be in adrenal fatigue state. Now, vitamin C, if you're deficient in it, you're talking instant adrenal fatigue. And your body can't make vitamin C. That's why we're recommending for a lot of patients the vitamin C with bioflavonoids. Ester C is a good brand, but any vitamin C with bioflavonoids, that's good quality. We're recommending about 2,000 milligrams 4 times a day. So they're always getting it, and you're not going to have bowel tolerance with this. The adrenal glands contain the highest concentrations of vitamin C, where it plays a crucial role in both parts of the adrenal gland. Vitamin C, along with chronic stress, lead to adrenal fatigue and thyroid dysfunctions. Vitamin C can reverse thyroid damage. Vitamin C can help the body absorb synthetic and natural thyroid hormones after a thyroidectomy. So vitamin C isn't vital, it is vital. Okay, you just got to have it. But the fact, think of this. If you're looking at this video and you've been diagnosed with small nodules that are precancerous, if you massively increase your vitamin D, your B12, and your vitamin C, and you go in there and you get your stress levels taken care of and you get your nervous system, do you think you might be able to save the thyroid? Mm-hmm. It's worth a shot. Okay, and then, natural sources. Oh, oranges, there's kale again, Brussels sprouts. Oh God, Brussels sprouts. Okay, yeah, I'm a big Brussels sprout fan. Okay, strawberries got to be organic because those things are some of the highest polluted fruits if they're not organic. Guava, kiwi, green peppers. Now, vitamin A deficiency. Poor thyroid function can cause vitamin A deficiency, and low levels of vitamin A can cause an underactive thyroid. So, see, when you're eating prepackaged foods, when you're not eating real foods, when you're not eating a plant-based diet, you're going to have nutrient deficiencies. Now, vitamin A is a byproduct of beta carotene, and these are going to be the colored vegetables, the oranges, and some of the green ones. And vitamin A deficiency could limit the body's ability to produce thyroid-stimulating hormones after a partial thyroidectomy. So this is, again, vital. Vitamin C, vitamin A, B12, and again, beef liver is in there always. Carrot, sweet potato, kale again, spinach again, apricots. And if you get apricots, one of the neat things is in the seed of an apricot, if you split that sucker open, there's a kernel, and you can get apricot kernels, which are loaded with vitamin B17. And everybody should be taking, a few of those every day. This is one of the most powerful anti-cancer supplements or nutrients out there. It's phenomenal. Broccoli, and when it says butter, we're talking about grass-fed, hormone-free, normal butter, not the hormone-laden garbage that we're exposed to. And squash. So when we look at this, you can see stress levels, physical, chemical, and emotional stress levels actually can cause the thyroid problem. It's not like a genetic thing. When we're talking a 40% increase in 10 years, it's obviously misdiagnosed and overdiagnosed from a deficient and sick population. Okay, so we have to stop that now. Think of this. Let's correlate it with, you already have this, sir. Okay, common sense. It's obviously not common. But if we had a group of water buffalo that had a 40% increase in 10 years of thyroidectomies, okay, that these, you know, these Doctors Without Borders are going in there and they're cutting out all these thyroids from these water buffaloes, then they got to start feeding them hormones. Wouldn't we go in there and just say, hey, wait a second, guys? Are we doing the right thing, or are we misdiagnosing it? Shouldn't we check the nervous system first to see, knowing that chronic stress can cause adrenal fatigue in a low functioning thyroid and cause maybe malabsorption of nutrients? Doesn't that make sense? Wouldn't we look in there to talk about like exercise and movement, how it helps with the lymph flow, how exercise can actually help the thyroid and adrenal function? Proper nutrition. We get people off of the toxic foods, and since we know the thyroid needs iodine along with multiple other tissues, okay, wouldn't it be a good idea to eliminate the fluoride and the chlorine and the bromine, okay, that our bodies are exposed to? Or if somebody has nodules on the thyroid, wouldn't it be a good idea to find out if they have exposure to the fluoride and the chlorine and the bromine, which can lead to those thyroid nodules and lead to a problem? I mean, it just again, common sense. Okay, sleep and sufficient rest, this is when your body regenerates, and prayer and meditation. I mean, it just makes sense. Now, for internet nerds who are saying, no, all the thyroids being removed are genetic, reference, baby, reference. Yeah. Okay, now, any questions?
Yeah, I got a question.
What?
Your thyroid, should we be concerned about our thyroid? You know, they had the fallout in Japan, nuclear fallout in food.
Yep.
Should we be concerned about our food?
Absolutely. The radiation from Fukushima, huge in our part of the world, huge. And in fact, if you're close to a nuclear plant, as weird as this sounds, a properly run nuclear plant, which is, you know, kind of like a conservative nuclear weapon. Okay, there isn't any such thing. There's a nuclear plant outside of Sacramento in California. I think it was called Rancho Seco, and they had a huge rise in thyroid cancers when that plant was going. It was like 4 to 5 times the national average. And when they shut the plant down, the thyroid cancer levels went down normal. So, and why? Because, I mean, we're talking the entire population is deficient in iodine now, most of the population. This is why you need a Lugos iodine, which is iodide and iodine, okay, and you need that combination because different organ tissues need a different combination. So supplementation is vital. It's vital. And Lugos iodine. Yeah, we get ours from Ancient Purity from England, and that's one of the highest concentrations and best forms I've seen. But since we can't move to another planet because this one's kind of it, okay, so far, you know, we have to supplement and stay here. Okay.
You think our food and everything will be affected also?
Oh, it already is being affected. That's why you've got it, as weird as it sounds, you can't wait for symptoms. It's like I was just checking this one kid who's got depression, anxiety, scoliosis, and irritable bowel syndrome, and she was like 19. And the mom said, you know, saw the report of findings and everything, and the mom says, wow, maybe I should get checked. And I said, no, wait for symptoms. Okay, you understand the sarcasm. It was like, are you nuts? Of course you got to get checked. Because, I mean, you do this, even in a toxic deficient environment, you're going to survive better. You know, and you will. Yep. And Fukushima's still going on. Yes, sir.
If someone is taking thyroid hormone replacement therapy and their thyroid stimulating hormone is still very high, what does that signify?
It just has to do with the body is looking for more of the T3 and T4, that the hypothalamus pituitary adrenal axis, okay, is still telling the body that it's deficient. So they may need to, hopefully they're going to switch from the synthroid, which is not good for them, to the naturally desiccated thyroid, okay, which is. Yeah. Yeah, so they may have to up the dosage. Yep. Yes, ma'am.
What do I eat?
Okay, if you've had your gallbladder removed, okay, you're going to have a challenge digesting fats. Now, this is the thing, because a gallbladder stores and concentrates bile. So when fat hits the duodenum, bam, it contracts so you can break down the fats. It can emulsify the fats, then you break the fats to the fatty acids. Without the gallbladder, you have a little bit of bile dripping in there all day long.
Screwed up my thyroid.
Just settle down. Settle down. Okay, I know this is the dark ages, dear. We're living through it, okay? Okay, I know. Okay. So with that in there, and granted, by the way, you know, the people that rip out gallbladders, they don't tell you got to increase your fat intake. I know. Medium chain triglycerides don't require the gallbladder, so looking at increasing your coconut oil and increasing a little bit of fat with each meal, so that way you're still going to be emulsifying it. It's just you have to increase your avocado, your grass-fed butter, your coconut oil. You know, you're going to have to get some coconut fat-based ice cream without carrageenan every day. I mean, it's horrible. It's horrible, you know. At least for God's sake, get her a half a pint of coconut fat-based ice cream every day. Okay, and stop complaining.
The other thing is, where do you get the natural hormones? Because you can't get them on the internet. I tried.
Yeah, they are shutting it down because it's really hard. You can't patent a natural hormone. I think they even took over. Do you know where you can get them? Compounding pharmacist? Yeah, look for a compounding pharmacist. I'm just asking a pharmacist.
There's someone in New Zealand. New Zealand.
This is California. Okay, I know you're a gentleman of the world. Okay, it's you just got to keep looking for it. You know, it's vital. You know, I mean, you can get legalized pot, but you can't get legalized the thyroid hormone in California. Yes, ma'am.
We have a question from Patty. What supplements do you recommend for Hashimoto's thyroiditis, and if you prefer supplements over food in some cases?
No, I'm going to tell you that next week. Okay, for Hashimoto's, you got to heal the gut. Okay, heal the gut first. And food is always recommended over supplements, because food is so... The vitamins in nature are always bound to things that up its potency. That's why vitamin C is always bound to bioflavonoids. Okay, there's always something. You're never going to get B12 by itself. It's always bound to some other complex, B vitamins and phytonutrients that up its potency. So in Hashimoto's, you've got to heal the gut because it's going to be a leaky gut. That means you have to go in and get the nervous system checked. You got to go in and, you know, recheck your lifestyle and make sure you're moving correctly. The foods you eat are going to be juicing and blending, but generally juicing root vegetables, which are going to clean the blood, because you figure Hashimoto's is from a leaky intestinal tract, and you've got this colon and intestinal tract that's a muscular tube that has this peristaltic wave that moves food through it. So if you're cleaning the blood, that cleans the arteries that supply that, because what causes a leaky gut? Compromised blood supply or nerve supply. So you do that with soluble fibers like apples, carrots, beets, turmeric root. Don't juice dark green leafies, because that's going to, also it's going to be a raw.
How about wild Mexican yams?
Yeah, that's actually a really good one too. Yeah, definitely. Definitely. And then heal the gut. That's going to seal it up. Then the thyroid will start healing once you get the adrenal gland working correctly. Yeah, but that's more details next week. Yes, ma'am. It totally depends. It'd be better to get B12 from a food source, okay, and you can't overdo it. And plus two, you need B12, you need intrinsic factors secreted by the stomach, so you need a healthy digestive tract to get it. So you got to go back and all the stuff we're talking about with healthy bacteria, the vitamin D, the vitamin C, the fermented foods, the healthy nerve supply, all of this stuff. So it's not just B12, it's not just vitamin C, it's not just the beta carotene or the vitamin A. You know, just really is just healthy stuff.